My name is Aarón Murillo-Ruiz. I'm a second-year medical student at Paul L. Foster School of Medicine in El Paso, Texas, and I'm going to be talking about an overview of COVID-19. First, what is coronavirus? Coronavirus are a large family of viruses that mostly cause upper respiratory tract illnesses like the common cold. SARS-CoV-2 is a strain of coronavirus that causes the disease COVID-19. The name COVID-19 comes from coronavirus disease, and 19 because this strain was first identified in December 2019. This pyramid illustrates an important concept that of the number of people infected with SARS-CoV-2, the virus that causes COVID-19, there are going to be many who have mild cases or are perhaps even asymptomatic. Generally, these aren't the same people who go and seek health care. Nevertheless, it's important to identify people with no symptoms or mild symptoms because they're still able to spread coronavirus to the people around them. Of the people who become infected with COVID-19, there are a number who develop more severe symptoms and even succumb to the virus. Generally, these are the people who are diagnosed in healthcare facilities, who can be treated and have their contacts traced. One important thing to note is that coronaviruses are able to spread via nosocomial infections. In other words, they can be acquired by people who go to hospitals or clinics for unrelated reasons. A little bit on the transmission of SARS-CoV-2. When you're out and about, exhale, talking, yelling, singing, you're always emitting things called respiratory droplets. These go into the air around us and can potentially be breathed in by those who are close to us. One example, whenever you sneeze, the respiratory droplets can reach up to 100 feet per second. There's no current evidence that COVID-19 can be transmitted through food, nor is there evidence that demonstrates that animals play a significant role in spreading the virus that causes COVID-19. And finally, mosquitoes are not known to spread COVID-19. Since the beginning of the pandemic, Johns Hopkins University has had a very useful resource on their website wherein they've documented the total number of global cases of coronavirus, as well as the number of global deaths and recoveries. As we all know, coronavirus has spread all over the world. The number of new cases is increasing every day, and it's more important than ever that we take actions to mitigate the spread and protect those in our community who are most vulnerable. In El Paso, coronavirus also continues to spread. Since the beginning of the pandemic, El Paso has had over 61,000 total cases. Texas has had just under 1 million cases. There are a number of misconceptions that have been relayed and shared by many people. Earlier in the pandemic especially, and even now, one of these was that the flu and coronavirus were more or less the same when it came to fatality or how likely it is for you to die from either virus. This graph from the Washington Post made in May of 2020 shows that this is not the case. At this point, already 60,000 people had died as a confirmed COVID death. Now, on the other hand, far fewer people had died or were confirmed influenza deaths. This shows us that we can't compare confirmed influenza deaths as being comparable to confirmed COVID deaths. There are many sources of exposure, but generally three main categories. You can catch coronavirus by traveling, being in close contact with someone who has coronavirus, whether they know it or not, whether they have symptoms or not, and community transmission, or also known as community spread. Now, what is community spread? That's when you go out, you go into the store, you go into a restaurant or somewhere in public, you become infected with coronavirus, but it's not clear what the exact source was. Community spread is very common in El Paso. When we're out and about running essential errands, it's more important than ever that we wear face masks that cover our nose and mouth, and that we wash our hands with soap and water frequently. An important concept to understand is the concept of flattening the curve. What does this mean? Broadly speaking, to flatten the curve means that the number of cases at any given time are more able to be managed by the healthcare infrastructure. Let me explain this another way. If we took no changes to mitigate the spread of COVID-19, we would see a sharp increase in the case numbers in a relatively short period of time. That's depicted by this red line here. This, unfortunately, is a scenario wherein the healthcare infrastructure, hospitals, and especially intensive care units would be overwhelmed, and likely it's a possibility they'd be unable to accommodate this surge of patients. Now, if we took some actions, we see a smaller, flatter, shorter curve spread out over a little bit of time. So basically you have more cases spread out over a longer period of time. And even if we take stronger actions, we see again this peak goes down. The healthcare infrastructure is better able to accommodate the number of patients and treat the people who come in because of coronavirus. One last note about spread. How can we contract coronavirus? Well, as I mentioned before, you are constantly emitting respiratory droplets in the air around you. Sometimes people around you can breathe in these droplets and become infected, or the droplets land on your phone, your coffee cup, your computer mouse, computer keyboard, shopping carts. And if these surfaces aren't cleaned regularly and someone else comes and touches them, and then without washing their hands or using sanitizer, they touch the dirty object and then touch their nose, mouth, or eyes, they can then become infected with coronavirus. So these are some preventative measures that we can take. Maintain social distancing. That means staying at least 6 feet away from the people around you. 3 footsteps, 2 big shopping carts, the length of a twin bed, or a yoga mat. Always wear a mask when you're out in public. They should cover both the mouth and the nose. You may even consider keeping a mask in your car if it's more convenient for you, and it'll help you remember. Wash frequently touched surfaces. Wash your hands often. Keep hand sanitizer close by if you don't always have access to a soap and water. And avoid people who may be sick or who have come into contact with someone who has coronavirus. Why is it important to clean frequently touched surfaces? Well, these graphs show us why. So on copper, coronavirus was detected up until about 8 hours after being planted on the copper. Cardboard, we can see coronavirus was detected even longer, up to about 2 days. Stainless steel, coronavirus was detected between 2 to 3 days. And then finally plastic, think about the handrails on shopping carts. Coronavirus was detected up to 3 to 4 days. So when you're out and about in the grocery store, you want to make sure that these frequently touched surfaces are cleaned often. Now, there are a number of symptoms that someone with coronavirus may have. 3 that you want to look out for are fever, cough, and shortness of breath. Symptoms can appear anywhere between 2 and 14 days after exposure. So, say you come into contact with someone who has coronavirus, and 5 days, even maybe a week goes by, no symptoms have come up for you yet. There's still another 7 days where it's possible that symptoms may develop. Because of this, anytime we come into contact with someone who has coronavirus, it's important that we take measures that allow us to self-isolate for 14 days at least after exposure. If you begin to develop symptoms, especially shortness of breath, it's important that you contact a healthcare provider or an ambulance if needed. Now, not everybody dies from COVID-19, but a number of lasting symptoms can result, lasting damage to your body. The infection can cause a hypercoagulable state. What this means is your body's more likely to form blood clots, which can cut off circulation. There's potential for lasting lung damage even after you've recovered. If your blood isn't getting as much oxygen as it needs, it can't deliver the oxygen all over your body like it usually does, and this can inflame the heart. It's a condition called myocarditis. And finally, these clots that may develop can even damage the brain. As we can see, some of the major risks for mortality from coronavirus are age and pre-existing conditions. Many deaths have come from nursing homes or long-term care facilities. It's especially important that we protect our older relatives and the older people who live in our community, because certainly they're the most vulnerable right now. Some more risk factors associated with COVID-19 deaths: heart disease, kidney disease, that's what renal disease means, pulmonary disease, hypertension, and diabetes. These are all very common. This highlights the importance of taking measures to slow the spread of coronavirus so that we can protect the most vulnerable people in our community. A little bit on treatment. Now, there's no cure or known cure for COVID-19, and currently treatment is supportive. In other words, you try to make the patient feel better by managing their symptoms. So you may give them ibuprofen or acetaminophen, also known as Tylenol, cough syrup, make sure that they rest and have adequate fluid intake. Remdesivir is an antiviral that has evidence of reducing the time patients spend in the intensive care unit, that's ICU. It's important to also note that chloroquine and hydroxychloroquine are not beneficial in the treatment of COVID-19, SARS-CoV-2. Antibiotics don't work on this disease because this disease is a virus, and antibiotics are used for bacterial infections. Now, it's possible you know someone who had coronavirus and was given antibiotics. This may be because their healthcare provider was trying to treat or prevent a secondary bacterial infection in addition to their coronavirus infection. And finally, some blood pressure medications or painkillers should not be prescribed in someone who has coronavirus. For more specific questions, consult with your healthcare provider. You may have heard convalescent plasma as a treatment in the news. What does this mean? So, when someone is infected with a virus, they have proteins and genetic material that are inside of them, and the person mounts an immune response by developing what is called IgM or IgG, broadly speaking, These are called antibodies, or proteins that help us fight off infection. Now, the idea behind convalescent plasma is to take plasma, that's the liquid part of someone else's blood. You take their blood and you can separate it into its components, and you have plasma and then you have the blood cells. But you take the plasma that has these antibodies already in them, and you give that plasma to someone else who has an infection with coronavirus. And the idea is that the antibodies in that plasma that you have now just put in another person, those antibodies will then help that person fight off their infection. Now, it's important to note, this is not an FDA-approved treatment. It's just an idea of something that may help people in the future, but more research is needed. Here's a little bit of data about convalescent plasma as a therapy. We can see on the left graph, CRP, which is a measure of inflammation, went down over the course of a day. Lymphocytes, these are immune cells in the middle graph, went up over the course of 4 days. And on the far right, the oxygen saturation went up over the course of a day. This is important because it tells us that more oxygen is being delivered. Now it's time for some questions. True or false? SARS-CoV-2 respiratory droplets immediately die when they touch any dry surface. We all know this is false. It can survive up to 4 to 8 hours on copper, 24 hours on cardboard, 2 to 3 days on plastic and stainless steel, and can also remain in the air for as long as 3 hours before dropping. True or false? Proper hand washing requires you scrub your hands for at least 10 seconds. We know this is false. You need to wash your hands for at least 20 seconds with soap and water. Flattening the curve means to help clinicians better manage a volume of patients at any given time. This is true. Flattening the curve is all about reducing the number of cases at a given time to reduce the burden on hospitals. This way, the healthcare providers can more effectively treat their patients. True or false? Associated risk factors for COVID-19 related mortality include chronic obstructive pulmonary disease, lung disease, arrhythmia, and heart disease. This is true. All these diseases are risk factors associated with COVID-19 mortality. True or false? Hydroxychloroquine is an effective treatment for COVID-19. This is false. Hydroxychloroquine is not an effective treatment for COVID-19. Finally, true or false? COVID-19 is something anyone can recover from with no lasting consequences. We all know this to be false. Although this disease can be fatal, many people survive. But even in people who have recovered, there's potential for lasting damage. More is yet to be discovered about this. I hope that this video was helpful. I wish that you stay safe and healthy and help us protect the most vulnerable people in our community. Thank you.